Welcome back. It is time for our deep dive where we talk about hard things and the things that you need to know. So today we've invited a team of experts to help us understand and uncover women's health, as broad as that may be.
That's right, let's put it out there. Joining us is Cate Luzio, founder and CEO of Luminary, a professional education and networking platform, friend of the show as well. Komel Caruso, co-founder and chief operating officer of Hermo, a comprehensive women's healthcare company. And then Dr. Heather Hirsch, a board-certified internist and menopause specialist focusing on women's health issues. Thank you all for being here today.
Thanks for having us.
Thank you.
Cate, as the boss of Luminary and the one who connects everybody, what are the main concerns that members have about their health?
So we saw over the past, really the last 18 months, so many in our community, both our individual members and our corporate members. Remember, we have a B2B and a B2C platform, saying all of these things were coming up for women, and we didn't want to keep them in isolation. So whether that's financial health, mental health, sexual health, reproductive health, physical health. And so we love Hermo,
yes,
great friends of Luminary and partners, and we decided to host this Women's Health Summit. It was our first, not the first for Hermo, but we wanted to bring women and allies together across all of these topics, because it depends on where you're at in your life.
That's right.
Right, and what's important to you in this journey. So we really want to focus on, and Luminary always has, it's not just about your professional journey, it's about your personal journey too, and all of that comes together throughout your life.
And I know one of the pressing issues you talked about was menopause, perimenopause. I feel like now you can't look left or right or know someone who either is not going through menopause, thinking about it. So Dr. Hirsch, I want to talk to you. What exactly is going on in a woman's body when she is going through, as Cate
laughing, she's like,
well, let me tell you her fan. What is going through our bodies?
You know, I always say the fact that we call estrogen, progesterone, and testosterone our sex hormones is such a disservice, because they affect our entire bodies from head to toe. So as we go through menopause, our ovaries, which make almost all of our estrogen, they are starting to shut down, and our sex hormones, that estrogen, progesterone, and testosterone, is starting to decline. So that means you're going to feel it in terms of hot flashes, right? That's why you've got your fan.
She's got her little fan.
She's got her fan.
Yeah, but women feel not just hot flashes, vaginal dryness, the sleeplessness that you see in the movies, but now we're really also finding there's so many symptoms: joint aches and pains, brain fog, irritability, mood dysfunctions, joint aches and pains, tingling ears, itchy skin, dry eyes, you name it.
I mean, it's everything under the sun, it sounds like.
And it's a lot, and it's scary, and it's more than just, like you mentioned, the few symptoms that are kind of like the ones everyone stereotypically knows, which is why Hermo, I love you guys, I've been following you for a long time. You were looking at the whole woman, because it's really affecting everything, internally, externally. So what are some of the, talk to someone about the financial effects then that you're seeing in the workplace for women who are trying to navigate everything that's going on?
Yes, so there are 15 million women right now who are aged 45 to 60 who are working, and 85% of women feel some kind of symptoms. And so the Mayo Clinic did a study, and the New York Times reported on it, that women lost $1.8 billion in the US due to lost productivity, having to call out sick from work, taking time off because of menopausal symptoms that are treatable. So they're experiencing brain fog, incontinence, hot flashes, and they don't feel support at work, and so they're calling out, but we're losing billions of dollars.
And you're in your prime earning years.
Right.
During
So
this
let's
time.
remind folks, what age range are we talking about here?
Yes, so, you know, menopause, the CDC says the average age of perimenopause in the United States is 47. I think it is much earlier, so I'm going to go with even early to mid 40s.
Early to mid 40s, which is our prime time, when we've sort of taken our 30s, we're mastering who we are, we feel comfortable in our skin, now we're going to the workforce, and now, oh my God, all this crazy stuff is happening to my body. How do I tell my boss, I have this humongous project, but I have no idea what's going on, or my head hurts, or my ears are itchy, and I don't know what the heck is going on? I mean, we laugh, but I know a woman who's like, my ears are sweaty and itchy, and I don't know what it is.
So one of the things that we're doing at Luminary is, because we have so many, we have over 100 corporate partners that we work with, we're bringing this conversation to them to be able to have that conversation with their employees. The other piece is, we're saying bring your employees to Luminary, virtually, in person, however you want, so they have access to learn about all of the things one, what's happening to their body, two, to have those conversations with their employers, and then three, to advocate for more policy and benefits to cover perimenopause, menopause, not just fertility, which is so important, the whole, again, life cycle of the woman.
The whole life cycle.
The whole life cycle, exactly. We had, and we're doing talks, we're bringing in our providers to employers, because that's one of the biggest hurdles, is being able to have that conversation and have a work environment that feels safe and comfortable with no shame or stigma to say, hey, I'm going through this. And so we educate women on their options, but also colleagues, HR departments, on how to support your workforce so they feel comfortable having those conversations. And as Cate said too, ensuring that they have providers who are in network, who are trained by the Menopause Society, who are trained by the International Society for the Study of Women's Sexual Health, a mouthful, ish-wish, so they have those providers in network that can treat them.
Yeah, the biggest issue is that if there is, 67 million women between the ages of 40 and 65, right now there's about 2,000 certified menopause doctors. So you can see the math doesn't math. So one of the things,
math ain't mathing.
The math ain't mathing, yeah. So I'm so passionate about teaching and, creating telemedicine so we can have access, utilizing AI, novel technologies so that we can get these women treated.
And you guys are such wonderful pioneers, you kind of like being the hub, and I feel like now I everywhere I'm seeing more and more of this, but you as a healthcare professional, have you started to see inklings of more being done to move in the right direction, specifically in how we're treating all the life cycles of the woman?
It's slow, but it's there and it's positive, and there is momentum now. So we have so many celebrities talking out. We have so many businesses being built. We have so many women on TikTok talking amongst each other. So we are getting there. I started a training program for clinicians last year. I now have over 300 doctors. There is so many more ways to really learn this information. If we go to medical schools and really advocate for young doctors to learn about midlife and menopause, how this affects chronic disease, it's going to be such a better, atmosphere for women's health in just a few years.
To that point, each of you, I'd love to hear before we go from each of you, how do we close the gap with the misinformation or lack of information when it comes to women's health, specifically menopause, be it in your doctor's office, with your family, or with the people you work with? I'll start with you, Cate.
Oh, okay.
Yeah.
I'm the medical professional. So I think really it's all about advocating for ourselves. It really starts with self-advocacy, right? So no one knows what you're going through except for you. So one, talk to the people around you. We were just talking in the green room before this. Talk to your friends. Learn about what's happening.
Bring your portable fan.
Bring your little fan.
There it is.
Everywhere.
You have a hot flash on live television, yes.
And talk to your employers,
Fantastic.
right? You have to.
Yes, and I would say along those lines, find your community. You have to talk about it and ending that shame and stigma and educating yourself, going to the Menopause Society website, finding those providers and coming with your list of questions. You have to be empowered and you have to advocate for yourself in the doctor's office.
Dr. Hirsch.
And keep talking about it. Keep talking about it amongst your friends, family, because the change that's happened in the last couple of years, the catalyst has really not necessarily been from the medical community downwards. It's really been from women saying, we're not taking this anymore. We're not sitting and suffering.
It's why HerMD and Luminary came together last week for the summit.
Here, here.
This is just a microcosm of what's
Exactly,
to come.
and so much out there, telehealth, etc. So,
well, thank you for doing what you're doing. Please keep doing it, and you're welcome back here anytime.
thank you.
Thank you.
Thank you so much.
Cate Luzio,